Dr. Laina here, and today we're going to talk about your sacroiliac joint and how to know if it's out of alignment, and you may need the help of a chiropractor, along with tips that I'll give you to help it heal. So, what is your sacroiliac joint? So the sacroiliac joint is probably the most common misdiagnosed joint that we see. So many people are coming in saying, Doc, I think it's sciatica, I think I have a disc issue, and what's really going on is that their sacroiliac joint is not functioning the way it should. That can be caused from too much sitting, from lifting improperly, and from poor footwear. So let me show you what the sacroiliac joint is. Down at the bottom of the spine, of course, we have the pelvis. So this is the sacrum, and these are your two ilium, right in through here. And so where they meet on either side of the body, those are your two sacroiliac joints. So when you walk, this joint is going to rotate back and forth. When you sit, it's going to rotate this way. When you stand, it's going to rotate this way. But now, because of all the excessive sitting we're doing and the type of footwear we're wearing, we're tending to put so much strain into these joints that they're locking up or not functioning properly and causing us a lot of pain and causing your body as well to use the wrong muscles to help make this area go, leaving you with pain and tension and sometimes even radiation down the leg. So, what are some of the signs that your sacroiliac joint is locked up or not functioning properly? Well, the first sign that that's going on is that you're going to actually feel pain right in through this area where the sacroiliac joint sits. That pain is likely going to get much worse when you're sitting. And the reason for that is that when we're sitting these days, most of us are sitting like this, which is putting an enormous strain on that sacroiliac joint in through that area and causing it to get more and more tense and inflamed and irritated, irritating the nerves in that area as well as we're sitting in this position. So if you find that when you're at your desk, after you've been sitting for a long period of time, that joint is hurting more and more and more, that's a very common sign that your sacroiliac joint is out of alignment. Another way that we know that your sacroiliac joint is likely the culprit of your pain is that it hurts when you get up from a chair and start to walk. So that change in position as the sacroiliac joint needs to move is quite painful. And you find the first few steps are quite sore, but the more you walk and move around, the better it feels. In fact, you could go for a 15-minute walk and it wouldn't hurt you at all. But the second you sat down in the chair, if you tried to get up again, you would notice that that pain was coming back. Another way that we know that your sacroiliac joint is likely not functioning the way it should is that you have IT band that you want to roll out constantly. So when that sacroiliac joint isn't working properly, the hip and all the muscles in through the buttocks and down the side of your leg have to work overtime and really get stretched and strained in order to allow you to continue to walk and move. So what you'll find is you have this incredible amount of tension down the side of your leg, and if you take your fingers and just drag them down the side of your leg there, that hurts quite a bit. So if you're wanting to roll and stretch your IT band on a daily basis, go check out your local chiropractor and ask them to check if the problem could actually be in your sacroiliac joint. And then the last symptom that often comes up that most people don't even realize is related to their sacroiliac joint is pain on the inside of the knee. So when this joint isn't functioning properly, it changes the way the muscles work in this area and the way the knee's tracking. And people will start to come into our office and they'll complain that there's pain on the joint on the inside of their knee. Definitely that can be due to many other causes, but one of the key areas we'll check when they come in with that complaint is the sacroiliac joint. And very often we don't do anything to their knee. We just ensure that their sacroiliac joint is functioning much better, and they'll come in the next time and they say, I can't believe it, my knee pain is gone. So now you might be wondering, well, that's great. I just figured out it is my sacroiliac joint. What can I do to keep it healthier? Well, one of the main things you can do to keep it healthier is ensure that you're not sitting for long, long periods of time in the wrong position. Basically, what you want to do is you want to make sure that you're not allowing yourself to get into the slump for long periods of time. You want to keep your body weight more forward, the back of your buttocks slightly higher than the front of your buttocks, and really realign yourself properly in your chair so you're not straining that joint on a regular basis. Of course, it's really, really important to get up as much as possible and move around so this joint isn't taking on stresses and strains that are building up throughout the day. So even getting up As you've heard many times, but it's great advice, even getting up for 2 minutes, an hour, can make an enormous amount of difference. The next thing that I would recommend when it comes to your sacroiliac joint is to really ensure that you're stretching it properly when you're sitting in your chair. So one of our favorite stretches is the figure 4 stretch that many of you have seen, but I'm going to review it quickly because most people don't do it properly. If I wanted to stretch that right sacroiliac joint, the first thing I'm going to do is make sure I'm not slumping back in my chair. So I'm going to have my body weight slightly forward, and I'm just going to take one of my legs and cross it over the other knee at the ankle. If you find this hard to do, you can certainly take that bottom leg further out to change the angle. So once the foot is crossed over the knee, all that you're going to do is sit up as tall as possible. So I'm not pushing this knee down. I'm not forcing anything. I'm allowing gravity to have this knee drop as I pull my chest up and sit up tall. If you feel a good stretch in this position, then you can hinge your body forward as if you're a door coming forward. So I can't emphasize enough that sitting up tall and coming forward 2 inches is going to help your sacroiliac joint far more than this type of thing we see a lot of people do. So this roundness I'm creating is straining the joint rather than stretching it. So sit yourself up tall, cross one leg over, breathe in and out for about 5 or 6 deep breaths, and then switch sides. And then the last thing that's really important to keep your sacroiliac joints healthy is to ensure that you're wearing proper footwear. So if your feet are rolling in and pronating when you're walking, you're going to put too much strain through those sacroiliac joints, and they're going to go out of alignment much more quickly. So check and see if you need to get a support for your shoes in order to ensure that your footwear is keeping your sacroiliac joints healthy for the long run. We really hope that this information was helpful to you. If you're wondering if your sacroiliac joint is out of alignment and you live in London or the surrounding areas, please feel free to call our office. If you have anything else we can help you with, please put your questions in the comments below. Click like and subscribe to our channel so we can give you much more information to keep your body healthy. Have a wonderful day.